What do people not typically talk about when it comes to physical therapy? What's up guys, my name's Antonio and I work in physical therapy, and if you are new to this channel, consider subscribing because we talk about the ins and the outs of physical therapy. So if you're interested in going into physical therapy, if you know someone who is, if you just like the content, whatever it is, then consider subscribing because that's what we talk about in this channel. And in this video, we're going to be talking about what no one else really does. It makes up a huge part of your day. So I would say that I spend about 60% of the time treating patients, and then the other 40% of the time writing notes. And that's what we're gonna be talking about today, is the documentation. So how do you write notes? What are some tips? Why is it important? It makes up a huge part of my day, but whenever you see a commercial or see something, you usually just see the treatment portion and you never actually see the paperwork side of things. So that's what we're going to be talking about today, but I figured the best way to do this would just to be to show you or talk to you when I'm done working. So I'm walking into work right now. It's super bright out and I'm going to treat some patients, then I'm going to talk to you about how I write my notes. So we just got done treating some patients now, and we're about to do our documentation now, writing our notes. So we wanted to let you guys know on some simple things when it comes to like what goes in the note, what are the notes broken up into, some tips on how to write better notes, and just the importance of documentation in general. So we're just going to talk on that. So let's go.
So notes are categorized in 4 major sections. Despite all the different components a documentation system might have, there's 4 categories that make up what we do, and they're spelled out by the word SOAP. So S is subjective, O is objective, A is assessment, and then P for plan. So let's go through that. So S is subjective. What does that mean? So S is what the patient and or their caregiver comes in to tell you, right? So it's how they're feeling that day, what they were able to accomplish or not able to accomplish, what they're struggling with. Basically what we're doing is choosing to listen to what they say and pull out relevant things for what they're coming in for so that we have it in the document or the history of the patient.
And so the next section is O, so that means objective. And this is like tangible things that happen. It's not based on subjective opinion, but it's based on facts. So what you did in that treatment session. So what you're capturing in that part of the note is like what you did. It's very just simple. It's whatever you did in that treatment session, that's what you're writing in the note. So if you did 4 sit-to-stands, you did 5 lunges, you did 10 squats, you did 2 sets of 10 on push-ups, then you did the bike. It's everything you did in that treatment session, you just document it. You write it down and you capture all the facts of that treatment session.
A is assessment, so that's the 3rd section, and that's where we come into play and we capture something clinically. So from their subjective, from their opinion, and from the facts, what do we make of it? What kind of assessment can we draw from that? Are they making progress? Did they struggle with something specifically? And what can we attribute that to? Like they had a hard time with step-ups because of strength or because they got tired too quickly. Like what is it associated with? So it's our clinical judgment or overall picture of what our assessment is of the patient.
And the last one is P, which stands for plan. And in this section, you're writing what you plan to do in future sessions. Now, this could be for the very next session or sessions to come, but basically you're writing down in the future, how do you want that patient to progress? So if you want them to progress or you want to focus on sit-to-stand specifically for the next session, then that's what you would write. It's the thing that you want to do in the future. Or you can even capture things such as like when is the next appointment, or relevant information that if I'm going to be absent that day and I want the PT to know that you need to work on this next session because I told the patient we were going to do that, then I'll write that in the plan section. It's basically a future section that you document what is going to happen in the upcoming treatments.
So now that we talked about what the components of the note are, we're going to talk about how we can more effectively write within those sections of the note. So the first thing I would do, or the first thing that helped me kind of get my mind wrapped around what it is that I want to put in a section, is think about who your audience is. So there's three groups of people that I think of when I write notes. And the first is a clinician. So if somebody followed in behind me and was going to take over care for that day because I called in sick, can they read what I wrote and can they pick up where I left off? So do they understand how the patient's progressing? Do they understand how functional the patient is? And can they progress it just based on reading what I wrote? Does it give them a good idea of the patient? The second group of people that I think of are insurance companies. So because oftentimes they're primary payers for physical therapy services, we want to make sure we're justifying our care. We want to make sure that we're providing skilled care and we're not just giving exercise like a trainer, for example. There's a education needed to be able to accomplish the things that we're doing. And so clarifying, like, not that just somebody has to get up from a chair, but this is important because it's important they get up from a soft chair or a low chair because that's the only chairs they have in their home, right? Make it more specific to the patient that it would make sense that they would have to be able to accomplish these things. The third group of people I think of are the courtroom. So people can come in with different cases, and when the court is involved from litigation or anything like that, it's important to remember that your documentation has to stand up in the court of law. Like what does that, what does that mean to write something that can withstand that kind of scrutiny? So that was super helpful for me to think about, is like, who am I writing this for?
And just to piggyback on that last idea of, writing towards a court system, one of the things they used to tell us all the time in the PTA program was, if you don't write it down, then it didn't happen, meaning that you don't have proof of it. So if someone questioned you, like an insurance company or a lawyer, or someone questions you that, did you actually do this? If you didn't write it down, then it didn't happen, so they could accuse you for something that you didn't do just because you didn't include it in your documentation. Or vice versa. If you add something in your note that isn't true, then that's a big deal as well. I actually know someone who wrote things, they extended the time of the session with the patient in their note, even though they didn't see the patient that long. So they wrote that they were with the patient for a full hour, even though they were only with the patient for like a half hour. And the way they got caught by this was the patient had a receipt from a store that they were at the store at the same time they were in therapy, or supposed to be in therapy. And so then when the insurance company and all that stuff found out about it, then they were in a lot of trouble for fraud because they didn't document correctly. So this is a very important and very significant part of your job that you need to do a good job on it, because it's more than just writing down for insurance companies or for the next clinician, but it could lead to different things if you can get in big trouble if you don't do this correctly and appropriately.
So another tip for writing notes effectively is to be specific. So if you have two patients and they both had a knee surgery, you should be able to tell the difference between one person and the next person. It shouldn't just be a copy and paste of the same exercises to one person. Even if they're the similar exercises, what makes them different though? Why does one person struggle more than the other? What does one person have to be able to get back to that the other one might not need to? Be specific, and you should be able to read the note and pick out what patient it belongs to. So
yeah, that's definitely a big thing. Let's answer some other questions that people might have. So some people always ask us, how long does it take to document? How long does it take you to write a note?
Well, it depends on what kind of note. So I have to write an evaluation, which is longer, or a daily note, which obviously is much shorter, a few minutes maybe.
And for me, it takes me 10 seconds tops. I'm just really fast at it. I'm just kidding. I'm actually not. It takes me maybe 8 minutes to write a note sometimes, different things. Depends too, on how much you did, how much you need to capture in it. If you did a ton of different things, then you have to type all that out and you have to record it. But definitely.
That's the other thing that matters though, is the documentation system. So
yeah,
electronic documentation and how the flow prompts you to make sure you're capturing everything, versus some systems are more cumbersome. You have to like go through a bunch of different screens, so that's a big part.
Yeah, so which system you use is huge. And there are even some companies who still use paper documentation system, which is a nightmare for me. I hate it. But definitely using a computer system helps you a ton. So for me, this is my least favorite part of the job. It literally is awful for me. I hate writing notes. It feels like I'm in school or something. It's so bad. But the problem with that is, if you start slacking off or you start getting in a rut and you start documenting things all the same, then that can lead to issues down the road. So some companies, they have audits where people will come in and review your notes from previous years or previous times, and they'll see what you wrote in them to make sure they're correct and they're accurate. So if you slacked off on a few notes, it might not be a problem then, but down the road, it might catch up to you and it might be a big issue. So you gotta stay up on your documentation.
Yeah, and there's some companies that actually hire people to do chart reviews, or people within your company can do chart reviews on each other just to kind of keep you accountable, making sure that you're filling out all the sections. And some electronic record systems do that already. They won't let you actually sign the note until you've completed it thoroughly. So there are a lot of checkpoints to make it a little bit more tolerable, but still probably not the best part of the job.
Yes.
So even if this isn't the funnest part of our job, it is a big component of our job. And that's why we wanted to bring it to your attention. How can we make this most effective? Because even though it's maybe not fun, it is valuable and it's very important to the patient and to the care team to have effective documentation. So just even with working with him, if I'm not there a day or I didn't see the patient that day because I was working with somebody different, I can look at his note and it's clear what went on and how the patient did. And if I see them next time, I know where we're at and what we're doing. I don't feel lost. So it is important.
Absolutely. So if you guys found this video helpful, then please hit a thumbs up on it and share it with a friend who's interested in physical therapy, your grandma, I don't care, just share it with someone. And we just wanted to help you out with your documentation. So we'll talk to you later then. Peace.